student Dr. Galloway. Today I'm going to talk about Ray, a 45-year-old African-American male who presents to the office. Ray's chief complaints are periodic dyspnea and fatigue. He also complains of occasional dizziness with no syncope, muscle weakness, and has no orthopnea. Ray has episodic depression and has worked for 10 years at a mine that's considered an ecological disaster site by the EPA. His vital signs that we have include a heart rate of 110 beats per minute, which is slightly elevated, a respiratory rate of 22 breaths per minute, which is also slightly elevated, and a normal temperature of 98.8 degrees Fahrenheit. Physical exam shows conjunctival and nail bed pallor, diffuse abdominal tenderness with no signs of trauma. There's some important information we are missing that could be pertinent to Ray's condition and prognosis. We don't know what kind of job Ray had while working at the mine. Was he working in the field or back in an office? We don't know what kind of toxins or chemicals that Ray was potentially exposed to. With regard to his depression, we don't know if he has been diagnosed with depression or whether he's receiving any kind of treatment, especially any medication. He describes his depression as being episodic, but we don't know exactly what he means by this, or whether he is currently depressed. We also don't know what his family medical history is, we don't know what his lifestyle is like, or which aspect of his condition is most important to him. We don't have the vital signs for blood pressure or pulse oximetry. We don't have a general assessment or his current allergies to any medication, food, environmental, or any medications that he may be currently taking. My first differential diagnosis was aplastic anemia. I found this most likely due to the symptoms of fatigue, as well as the cardiopulmonary problems that could potentially lead to dyspnea, the pallor that's present, and the fact that his condition can be caused by exposure to toxic chemicals. Some other differential diagnoses include orthostatic hypotension, and this one was listed because I thought it was interesting that this could be related to medication for depression, but again, we don't know whether he is on any current medication for depression. And there's also the absence of orthopnea with orthostatic hypotension, as well as acute myeloid leukemia. This one can occur due to industrial chemical exposure, and it can result in abdominal fullness and fatigue, as well as chronic myeloid leukemia. This one can lead to fatigue, abdominal pain. But with Ray's case, we have no reports of fever or night sweats, which leads me to believe that this is not the case. And as well, there's pheochromocytoma, and this has symptoms of tachycardia, fatigue, pallor, abdominal pain. So these the other four share some of the signs and symptoms, which means they're worth considering, but they do not explain all of his presenting signs and symptoms. Aplastic anemia is a disease in which hematopoietic stem cells are either absent or have been destroyed. Their destruction leads to pancytopenia, which is a gross reduction in the number of red blood cells, white blood cells, and platelets. This destruction of hematopoietic stem cells within the bone marrow is believed to be caused by the activation of lymphocytes due to a wide range of causes including gold, toxic chemicals, or radiation. These lymphocytes then release interferon gamma, which inhibits hematopoiesis and induces apoptosis within the bone marrow. In addition, CD34 cell populations have been shown to be decreased in patients with aplastic anemia, and this is believed to be factored in with the autoimmune aspect of the disease, as well as there's an induced nitric oxide synthesis within the bone marrow that also leads to cytotoxicity, decreasing the number of those hematopoietic stem cells. T regulatory genes such as FOXP3 and NFAT1 are decreased in patients with aplastic anemia, and these genes play an important role in preventing autoimmunity. So their dysregulation suggests the possibility of the autoimmune aspect of the disease. The screening test of choice would be a complete blood count to check for pancytopenia. And after the CBC has shown evidence of pancytopenia, a more invasive diagnostic test would be used in order to actually diagnose the disease. And this test of choice would be a bone marrow biopsy. This test would provide information on the bone marrow's cellularity, thereby allowing us not only to diagnose the disease, but also its level of severity. So a moderate aplastic anemia would be considered a cellularity of less than 30%, whereas severe would be less than 25%. And very severe would be one that's including the less than 25%, and the ANC is less than 200 per microliter. Ultimately, the treatment for Ray will need to be a bone marrow transplant to replace his lost stem cells. In addition, Ray may need blood transfusions. This could be until the transplant is actually found for him, and also until it's taking effect. Due to the immunosuppression from his low white blood cell count, Ray may also need antibiotics and growth factors. He may need to take immunosuppressant drugs in order for the transplant to work, because his own body could attack the transplant. Ray's low platelet count means that he will be much more vulnerable to bleeding and injuries, so it's important that he avoids activities that could result in cuts or falls. And various immunosuppressants that could be used include cyclosporins, antithymocyte globulin, corticosteroids, colony-stimulating factors, as well as antibiotics and antivirals. The Belmont report states that the three tenets of ethical considerations clinically include autonomy, beneficence, and justice. For Ray to maintain his autonomy, we need to make his treatment a shared decision-making process, where Ray's concerns, choices, and preferences are always factoring in. We also need to know what is most and least important to Ray with regard to his lifestyle and potential impact from his treatment. Beneficence means maximizing benefits while minimizing risks. For Ray, this could include the immunosuppression aspect of his treatment, as well as how his depression might be complicated by his condition and treatment. It's important to make Ray aware of local support groups for others with aplastic anemia as well as depression. It would also be a good idea to get Ray to see a psychiatrist or to get in contact with his current psychiatrist if he is seeing one. Justice means treating everyone equally. We need to make sure that Ray is getting the treatment that he needs, and medical costs could be a huge concern for him, so we need to take that into consideration here. We need to inform Ray of his diagnosis, treatment options, prognosis, and how his disease could impact his lifestyle. Ray also needs to be made aware of the risks from injuries. Bone marrow transplants may not be readily available, so Ray may need to wait some time to get one. BeTheMatch.com states that it can take between 10 and 21 days for a graft to begin producing blood cells once it's been transplanted. The 5-year survival rate for patients over 40 is 50%. So given these risks, it's important to discuss end-of-life care with Ray. And Ray is still pretty young, so there's a good chance that he has never seriously considered end-of-life management. So some important considerations include making a living will, and if Ray's family knows what his medical preferences are, should he be physically unable to make them known to them at the time. And in this regard, we also have who has the power of attorney. This is most likely going to be a close family member or friend. So these can be very important for end-of-life care management. Aplastic anemia is a very serious disease that may drastically alter Ray's lifestyle. However, it is a manageable disease. Ray is still relatively young, and he is seeking treatment prior to a major infection or injury. So I think that the prognosis is pretty good, all things considered. At all points in the treatment process, it's vital to include Ray himself and to take his thoughts and lifestyle into consideration. I've listed here my references. Thank you for your time.